Welcome to Group 9's Advocacy Project. We are going to be discussing the implementation of long-term care and access for formerly incarcerated men experiencing substance abuse. Our project consists of Adeza, Amelia, Christy, Yasmin, Jessica, Sagan, and Cheyenne. To guide you on what's to come, we will be discussing key issues and challenges, our community partners, how our plan aligns with ANA Code of Ethics, how our nurses can mitigate stress when working with our population, and our amazing advocacy plan. Enjoy.
Background. As the number of men in prisons continue to rise, this study examines the contributing factors to incarceration, such as misuse of substance abuse, pre-prison risk factors, and the post-prison reentry process. Through recommendation of evidence-based practices, we were able to create a multidisciplinary advocacy plan that implements a variety of perspectives, diligent case management, and long-term treatment.
There are numbers of key issues that contribute to substance abuse among formerly incarcerated males. Substance abuse is linked to psychological and environmental risk factors. Formerly incarcerated males generally suffer from substance abuse disorders because they're afflicted with psychological disorders such as post-traumatic stress disorder. As this population has limited access to housing options, they tend to live in chaotic and dangerous home environments, which expose them to illegal drug markets. Without stable housing and good credit, it is nearly impossible to find a job after prison. Psychosocial challenges can influence prison reentry. These individuals suffer from chronic diseases, are unable to access treatments due to no insurance and limited federal health coverage. High costs of treatments and lack of housing discourage participation of substance abuse treatment programs. Lack of family and social supports spark the overwhelming urge to use drugs to offset these stressors. Low community and social network make them difficult to transition smoothly into society. Currently, gaps of community-based programs include drug treatment programs, and nonprofit centers only provide short-term resources for these individuals.
To explore the connection between the vulnerable population health issue we chose, we decided to search local organizations in Los Angeles because of its high rates of incarceration. Christy found Project 180 LA. Founded in 2006, they serve individuals with a history of homelessness, involvement in the criminal justice system, and who are struggling with addiction, substance abuse, and mental illnesses. The organization recognizes the substantial need of the community, so it aims to provide valuable resources to formerly incarcerated individuals to lower recidivism through their comprehensive reentry programs and diversion programs. Programs are led by specialists, including case managers, therapists, substance counselors, LVNs, psychiatrists, CNAs, and peer navigators. With each professional's expertise, they can provide culturally competent and trauma-informed care to the solution-making process. Their mission guiding their work in the community is to improve the lives of formerly incarcerated individuals. Through our interview with Miriam Avalas, Assistant Director of the organization, we learned about the organization's vision, how they serve the community, and their areas of need. They utilize the principle turning lives around to achieve their mission and carry out their purpose. They serve their community by providing an array of services including behavior and mental health, life skills training, psychiatric and therapy services, substance counseling, intensive case management, and employment search and preparation. Although the organization has the tools and resources for the vulnerable populations they serve, they still require the infrastructure and expertise for program evaluation and outcomes measurement. Understanding the impact and outcomes that arise from their programs is critical to ensure their effectiveness. In addition to organizational needs, the populations they serve are in need of affordable housing, education resources, and more harm reduction services.
Actionable Advocacy Plan. Our goal is to create a resource that provides long-term support and case management for formerly incarcerated men after graduation from residential drug treatment programs. That's because we've identified a large gap in care between leaving RDTs and finding long-term stability in housing, employment, healthcare, and social support systems. Lack of access to these resources contributes to increased relapse and recidivism rates as well. To meet our goal, we would create an agency that provides long-term support and case management services, which include health and mental health services, housing and employment navigation, social support, including recovery meetings, access to and assistance with food, transportation, and finances, and mentorship by other former inmates in recovery. The agency would be staffed by nurses, physicians, mental health providers, social workers, and former inmates in recovery. Clients would enter our program upon graduation from their RDT, and we would have multiple locations throughout Los Angeles County. Advocacy plan steps in action. First, meet with the RDT to identify graduates, and a nurse will reach out to initiate contact. Step 2 is conduct an intake assessment to identify areas of need, pair the client with a treatment team and case manager, and create a treatment plan roadmap. Step 3 is the client will begin treatment, including weekly meetings with their nurses and case manager. Step 4 is the treatment team will meet quarterly to assess and evaluate treatment plan efficacy and make adjustments as indicated. And step 5 is to integrate changes into the plan and continue monitoring through follow-up meetings with the treatment team for the years that the client is in the program.
Some of the ANA Code of Ethics provisions that relate to our population was Provision 1, respect for others, and really trying to practice trauma-informed care when serving formerly incarcerated individuals living with substance use disorders, as well as Provision 2, commitment to the patient, really understanding health holistically and providing those wraparound services to maintain a long-term care for our patient, as well as Provision 7, the advancement of the nursing profession, really understanding how policies can affect the care for certain populations. And I talk about the Drug Addiction Treatment Act, which helped providers provide medically assisted treatment outside of opioid treatment programs. Between navigating moral distress and moral resilience, there is a moral obligation nurses carry to serve vulnerable populations. As a nurse, there are multiple approaches to help alleviate challenges formerly incarcerated individuals face. What we realized is that it's a very complex issue and really requires looking at health holistically, as well as being able to maintain long-term health care for an individual. After kind of that lapse of care and kind of that gap after rehabilitation, it's important to be able to provide an individual their basic needs and having those be met. As well as beginning to destigmatize substance use disorder and really starting to change the narrative and understand that it is a chronic illness that requires constant healthcare follow-up and support systems, as well as beginning to destigmatize criminal backgrounds and really understanding how those affect livelihood and being able to access a consistent job. We really understood how these things can really help reduce the risk of recidivism and help a individual reintegrate much more smoothly into society.
The role of a clinical nurse leader caring for incarcerated men ally with Provisions 7 and 8 of the ANA Code of Ethics. Although we provide care for patients, we also want to advance the nursing profession with evidence-based practices and observing standard of care, such as the Code of Ethics. We aim in collaborating with others and looking to the disparities not only as individuals, but also as a professional body of future nurses. These provisions not only provide ethics at the point of care, but to be able to facilitate our role in understanding the complexity and appreciating the complexity of implementing these interventions for this particular population. We found that the reentry period, also known as a window of opportunity, is a crucial aspect when providing trauma-informed care in order to ensure successful outcomes while reintegrating back into society. By doing so, we found that establishing partnership and building a consensus can bring a collaborative approach and diverse perspective to serve this population and meet its needs.
Helping others to manage issues such as substance misuse, mental health, past traumas, and societal reintegration can take a huge toll on the CNL, physically, mentally, and emotionally. High work stress, heavy workloads, and low pay in comparison to student debt can put the CNL at risk for psychosocial response to stressors on the job, also known as burnout and moral distress. Naturally, this type of a response can make healthcare workers disengage and ultimately abandon their jobs or even the healthcare field altogether, subsequently affecting continuity of care for their patients. Self-care, like like exercise, journaling, meditating, and utilizing social support networks such as family or even coworkers who share your plight help to mitigate feelings of burnout. On a larger scale, as nurse leaders, we can help team members experiencing these feelings by referring them to proper resources or by joining committees or teams that bring light to troubling ethical dilemmas in the workplace. Fostering team dynamics, conflict resolution, and accountability within the team address issues that can lead to feelings of staff distress. You can't care for anyone if you don't care for yourself first. Even on airplanes, we know that you have to put your own oxygen mask on before you can help your neighbor.
If interested in how we gathered our data to create this project, here are our references. Thank you for listening to our advocacy project. If you would like to further support us, please bring your wallets to attend our silent art auction. All proceeds will be going towards reintegrating formerly incarcerated men struggling with substance abuse back into society. Thank you.